Hi. So today let's talk about mouth ulcers. Mouth ulcers are a very common problem in many people. They're just really small pinpoint lesions that are really painful and can make eating, drinking and talking very difficult for you. So usually women and young people with a family history of these mouth ulcers are very likely to develop them. And these are not contagious, like it won't spread from one person to another person or it won't spread from one place to another place in your oral cavity. It's not contagious at all, but it's really, really painful. So what are some causes of these ulcers? You can get it very commonly, like everybody has it, almost everybody has it. So what are the causes of it? It can be because you accidentally bit your cheek or your lip or your tongue, or it can be because of an improper diet, or your diet is like too hot or too spicy or too hard to eat. Mouth ulcers can also occur due to underlying stress or anxiety in people. It can also happen due to some hormonal changes that happen in women during their menopause or menstrual cycles. They can also happen due to improperly fitting dentures that you have in your mouth, or because of some sharp tooth that's getting in your way. So mouth ulcers can also be caused by some underlying diseases like herpes, stomatitis or chicken pox, intraoral lesions of chicken pox, etc. So what are some tips that I can give you in order to prevent mouth ulcers, or for a better management of mouth ulcers? So basically the first tip would be drink plenty of water, keep yourself hydrated, because that will reduce your chance of ulceration in your oral cavity. The second one would be try and avoid too hot and hard and spicy food, because that irritates your oral cavity and that can lead to ulceration. The next one would be if you already have an ulcer in your oral cavity. So you can take an anesthetic gel, which is a lidocaine ointment. You can apply it over your ulcer and leave it on for like 15 minutes before you have your food. This way you can have your food in peace. I would also advise you to apply some kind of an antiseptic gel over it, because a mouth ulcer can act as a hub of an infection. So applying an antiseptic gel over it can prevent any kind of infection that happens due to an ulcer. You can also do around 2-3 gargles of saline per day to reduce your burning sensation in the mouth. If you have an ulcer in your mouth that is for like more than 2 weeks and it's really painful and it's really big, I would advise you to go to your nearest dentist immediately. There's a latest trend of treatment that's called the laser therapy. So what the laser basically does is the laser attracts a lot of mast cells to the localized area of the ulcer, which helps in healing. It also increases the blood supply to the area, which also helps in the healing of the ulcer.